Hello and welcome to DIY Therapy. As always, we'll start with our disclaimer. This podcast is for educational purposes only. It is not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professionals prior to beginning. Information on this podcast is not designed to replace medical treatment. My name is Will. With me, as always, is Sipping Andy.
Sipping Andy. Well, that just sounds...
Well, you took a big old sip of your coffee.
Well, we're going to change this podcast to Coffee Talk.
I don't know how many people would remember. I don't know how many people would remember that.
That reference?
Yeah, I don't know how many.
Yeah, well, I barely remember it.
It's just Mike Myers, and it's just...
Well, I do remember it. I was actually more annoyed by the skit than anything else. It was an SNL skit way back when. In the mid-90s, right?
Yes. Yeah.
Mm-hmm.
Mid-early 90s, yeah.
Yeah. And it was, some of them were good and some of them were brutal.
Much like every skit.
Every SNL skit.
Yes.
So, all right, what's the topic today?
We're kind of doing something, we know them as modalities. Other people just like ultrasound, e-stim, so like TENS units, dexamethasone, things of that nature.
Yes.
Whether they're good, bad, indifferent, what do they do, what don't they do, what do they...
Mm-hmm. Yeah, so why don't you start off with let's just talk about your overall thoughts on modalities. What are you thinking? Most of
the research have shown that they don't do nearly what they claim that they do. Or what, therapists, heck, even 10 years ago thought that they did.
Yeah.
I
mean, I think with everything in therapy or with anything that's constantly progressing, that, as new things come out, people have this hope and this desire that it's going to be the new quick fix. And there's a natural kind of swing where everybody kind of gets on board with these things, and then the pendulum kind of swings back after the research comes out that maybe they're not quite as effective as what we originally believed and thought they were. But yeah, to go through some of there's iontophoresis, which is like a local anti-inflammatory. Which is also
that's the dexamethasone. That's the
dexamethasone. It's a local anti-inflammatory that's pumped into the skin through an electrical current, basically two positive ions being pumped back and forth across the membrane of the skin to try to get that anti-inflammatory into a local inflamed area.
Okay, so just the theory behind that is basically like it's taking two magnets that are both north and then pushing it at each other, and just the theory is to try to push it in that way as opposed to giving a shot.
Yes, and so and then to obviously get that treatment on a semi-regular basis so that you're getting that anti-inflammatory into that area regularly.
Yeah.
So let's see. I've been practicing for almost 12 years now. 11. Is it 11 or 12? I don't know.
Are you asking?
And we used to get quite a few referrals for iontophoresis. It's not something that we're seeing a whole heck of a lot now. In fact, I think I've had one in the past year, partly because the research doesn't really support it. And let's just back up here for 1 second before we get into all of this stuff. One of the reasons why we're having this podcast and why we think there's value in this podcast is because it's important for people who don't understand what these modalities are to really have a better idea of where they need to focus their energy and their efforts. We've had, I'm sure you can attest to this, I don't want to totally speak for you here, but I've had personally many people over the years that have come in and absolutely demanded that, hey, 5 years ago I had an ultrasound, or 5 years ago I had e-stim, and it absolutely worked. I need it again, and almost get upset if we don't do that treatment every single time that they come into the clinic, and almost really their outcome is then hinging upon whether or not they get that treatment or not. And so overall, and this is not even my bias, this is really what the research actually indicates, is that for the most part, modalities are not deemed effective effective. It does not mean that in the past that if you've had them and you've had success with them that you can't have success with them. But when we start talking about clinical significance, there isn't a large enough number of people when we look at the research that actually have a positive reaction to these types of treatments to where, hey, we need to be treating everybody with it. So yes, there are special cases. Yes, it does mean that there are some people that will benefit from this, but the vast majority of people are not going to. And so it's just important that you understand if your clinician or your therapist is kind of trying to draw you away from those things, there's a reason why. One is it starts to get you to understand that, you are in control of your pain and not some modality. Ultrasound, electrical stimulation, these types of things help to maybe aid or push you into the correct direction, but they are not exactly the
end all be all.
That's exactly what I was going to say. And so, this is really more just educating individuals on, where their energy needs to be focused. I don't know. Is that a good little disclaimer of why we're doing this?
Yeah, I'd agree. It's I have had over the years, it's been less and less of people saying, why aren't we doing ultrasounds? We did this last time. It's been, a while since I've ran across somebody that has, demanded or, made it. Most people are usually pretty accommodating about it. You're usually like, yeah, last time I got an ultrasound. Are we going to do that this time? And I'll just say, well, most of the research has shown that it's, doesn't really do a whole lot or yada, 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 and so usually can once I educate the person, they're like, oh, okay. Usually they're fine with everything.
Yeah, and honestly, a lot of that, I think the decline in that is one, the education being disseminated very much more across the therapy industry, but also now across the medical doctor industry. I think there was a lot of even 6 or 7 years ago when the research started coming out that it wasn't as effective, we were still seeing a lot of referrals for ultrasound, electrical stimulation, and the doctors were planting the seed in the patient's head that they needed these things. And therefore, then when they weren't getting into the clinic and receiving them, then all of a sudden they thought they weren't getting the treatment that they needed. And therefore, it had kind of a negative placebo effect, which is really considered like a nocebo effect, and it impacted people's outcomes. So I think the clinicians or the MDs, the doctors, have actually done a better job of not pushing those types of passive treatments, on their patients or planting that seed. So I think that's a good thing too.
Yep, I agree with that. I'm not sure if what is it? Icy Hot with Shaq has got the e-stim.
He usually does like a little shake or something like that too.
I don't know what he does. It's
Shaq.
It's Shaq. He's a giant man. Have you seen the picture of him holding a regular sized water bottle?
No, I have not.
Well, it looks about what you think it looks like.
What's funny about Shaq is how long has he been retired now, right?
Longer than he's been playing? I don't know.
Gosh, he's got to be pushing 45 or so.
At least,
so he's probably been retired for 10, 12 years, and he's still out there. He's still such an icon.
He's great. He's great.
Oh, and he's hilarious.
Yes.
Just from a personality standpoint, he's apparently he's hilarious. Not that I've ever met him.
Nice disclaimer.
I heard through the grapevine, if you know what I'm saying. So I don't know. You want to go through each modality and just kind of talk about a little bit about some of the science behind it. We talked a little bit about iontophoresis. Kind of went out of order there. We can pick up with maybe e-stim.
Yeah. So the theory behind e-stim,
electrical stimulation.
Yeah. So like a TENS unit. What I was just talking about with Shaq. The theory, the way I was told to tell it to patients was I've heard it described like a train station. I've heard it described as a bus station, yada, yada, yada. But the nerve can only, sort of the same effect as if you slam your thumb in a door and you suck on your thumb, it makes it feel a bit better, but the thumb's not fixed, so to speak. So it's basically blocking the pain, but it's not really blocking the pain. It's just kind of overriding the pain. I always kind of describe it as you have 20 people in a room yelling, something else, and then one person's yelling pain, and you just can't hear that one person, essentially.
Yeah, I mean, yeah, those are two good ways to describe it. Essentially, it just blocks the perception. You've got to think of it as like, any kind of signal that's going from, say, if you've got knee pain that's going from your knee all the way to your brain, basically that electrical signal that kind of goes through that whole system, the e-stem system, blocks that transmission to the brain, so your brain can't perceive it. There's good and bad. Like e-stem, I still think to this day is probably one of the more applicable.
Yeah, I'd agree with that. It works well for specific kinds of pain, like nerve painy stuff. It doesn't do anything for, but muscle pain kind of. Yeah, it works on certain people.
Yeah, and it can be used like the way that I always, because a lot of people nowadays, 15 years ago, TENS units used to still cost upward of $100.
Yeah.
Now you can buy a TENS unit at home, which is kind of, for people that don't know, a TENS unit is a portable e-stem. You can buy a TENS unit at home or through Amazon, for I don't know, $25 to $35.
Yeah.
And so a lot of people will come in and say, well, I've got a TENS unit, should I use it? And so the answer that I always tell people is, well, it depends. TENS units are meant for managing pain. So it kind of comes back to every philosophy and theory that Will and I have talked about in these previous podcasts is, the whole goal at this onset of trying to fix something is trying to decrease the pain to begin with, modify whatever triggers that we experience, decrease any type of inflammatory response, basically calm it down, and then reintroduce activity in a very systematic way, and then build resilience and tolerance to different motions, activities, strains, etc. But the key here is that some people have such a hard time getting to that modification or that management phase where they can't get their pain down. So, pain, a TENS unit can be used and can be effective to help break up that pain pattern. So if someone's in constant pains, and we have the pain scale of 0 to 10, and if they're at 6s and above on a consistent basis, well, put the TENS unit on there for 25, 30, 40 minutes, and that can help maybe lower you down, lower that pain level down a bit, so that you can maybe introduce a few other concepts or ideas or movements or whatever it is, so that you can maybe have a little bit of benefit from that. It can be effective in that manner. It can be effective if that you're going to do something that you've identified a trigger for your pain. You absolutely have to do it regardless. So you ice and you put your TENS unit on it right afterwards for 20, 30 minutes, and that helps to calm those symptoms down, and then you move on with your day. A TENS unit should not be used. This is probably, in my opinion, written in stone. A TENS unit should not be worn all day long.
No.
Okay? You need to be able to perceive your pain so that you can continue to identify where you're at in the whole process of, should I rest? Should I do an exercise to relieve pain? Should I ice? You have to be able to continue to assess your pain. So if you're using a TENS unit just to block your symptoms altogether because you're just having pain all day long, that's not a good strategy. It's not a good philosophy, because at the end of the day, you've got to stop using the TENS unit, and then that pain may return, and you may have blocked all these things that you were doing throughout the day and not realizing how much you're agitating it. And all of a sudden, you take the TENS unit off, and you're in this huge inflammatory response, and your pain is unmanageable again. So, there's different strategies and different ways that it can be maybe much more effective and still applicable in today's world, even though, the initial use of it on every treatment, every visit that patients were coming in that we were doing maybe in the late 90s, early 2000s, that's not applicable, but there's still some application that can be used to help manage your symptoms. So TENS unit and e-stem is, in my opinion, probably still the most applicable today. Yeah,
they of all the three that we talking about today, that one actually does work to degree for specific people.
Mm-hmm. Yeah, and actually, now that we're talking about it, the icy hot aspect, which is with Shaq and everything, is a topical analgesic. It acts very similar to a TENS unit where it provides that burning sensation, that kind of cool burning sensation that, again, is just another input to the system that helps the brain not perceive it. So it doesn't mean that you are lathering your body up with icy hot every minute of every day, but it's another thing where, hey, you're in a little bit more pain, ice, put some icy hot on it. Okay, that may help get you out of that cycle for a little bit. All these things are really just helping to get you out of that pain cycle so that you can move forward.
Yep. I think that sums that up pretty well.
Yeah, I think for the most part.
Yeah.
Any questions, they can email us. I mean, we get all kinds of emails every day.
Yeah, like if anybody, yeah, lots and lots. I spend most of my day going through those things.
Yeah, that's, my mom and your mom, they just keep, emailing you. So, our two listeners.
Yeah, but yeah, if anybody does have any question, like if a TENS unit might be right for them, if they see a specific one, it would maybe good. You could just email it to us with a question about it with at DIYtherapy@206@gmail.com. We'd be able to help you out a little bit, maybe.
There you go. Or tweet us.
Yeah. Tweet at us.
Tweeter?
Yeah, I don't tweet. I mean, I look at it, but I don't make any tweets.
We're so good at self-promotion, aren't we?
I mean, people have to follow me before I start tweeting, right?
No.
Otherwise, I'm just yelling. So. Otherwise, I might as well just go out and yell into the void.
The vast void of Twitter. Dun, dun, dun. All right. So then the other big one is the ultrasound, right?
Yeah, and let's see.
Do you want me to talk about the ultrasound?
All right. Well, I can.
The theory behind it.
Let me see if I can remember it because it's been so long. It can be used in...
You can tell we use the ultrasound a lot.
Yeah, it has been a long time. The theory originally was a deep heat, quote unquote. Like, so if you put a heating pack on you, it only goes, 3 or 4 centimeters? I don't remember. What is it?
Yeah, not even close. No,
I don't remember.
It barely penetrates a centimeter.
Yeah, so whatever. So it doesn't go very deep. The ultrasound, is theoretically supposed to go below the skin and into the deeper tissues, I guess the theory was. There's also the theory that it was also, help with inflammation with cavitation.
Oh my god.
Did I get that right?
I should have explained this.
Nah, I nailed it.
Winner. Okay, so there's
I don't, in my defense, I don't use ultrasound. I don't like ultrasound. I think it was worthless when I was going through school, and so it irritated me every time I had to do it.
Well, yeah, you know what? You're not way off base on that because that's kind of where I was at with it too. All right, so here's the things. There's two ways that ultrasound was originally, in theory, meant to be beneficial for an individual. One is, as Will was kind of trying to
mumble my way through
and completely incorrectly describe you, is a deep heat. So, like, if you put a heating pad on your shoulder, your neck, whatever, I think the research says it may penetrate up to a centimeter. So, the ultrasound was designed to have a deep heat effect, operating anywhere from 2 to 5 centimeters, depending on the settings. So, it was going to penetrate to deeper tissues that hot pack couldn't actually get to. So, that's number one. And part of the problem with some of that too is that, in my opinion, heat probably isn't really the most beneficial thing to be doing with the majority of problems anyways. That's another topic of discussion that we can get onto. We're not going to get too far on a tangent with that. So in one sense, that's not really something we want to be doing with a lot of different tissues. The other way that it was really originally designed for was to basically kickstart the healing process or the physiological inflammatory response. So what ends up happening with any type of injury is there is an inflammatory response. So there's a cascade of physiological events that occurs. And to kind of get through most of the muck of this, essentially what happens with most inflammatory responses is that the body over-responds. So, perfect example of this would be when you roll your ankle, all of a sudden it turns into, the size of a softball. And yes, there is an inflammatory response going on, but it is way too large of an inflammatory response that occurs. And so what ends up happening when inflammation is, or when there's static fluid that's sitting around the injury through the inflammatory response, what ends up happening is no cellular activity actually occurs. Okay, and so there's too much fluid there, everything gets bogged down, nothing's actually occurring, and everything becomes static. So the theory really comes down to that there are small little vibrations that are being sent through the ultrasound head and transmitted into the skin. And then when you start to send those small little vibrations down to the cellular level, what they do is they actually will start to increase cell permeability, meaning that ions can now start to transfer back and forth across those cells, and then it starts to initiate that healing process. It starts to initiate that cellular activity that will get the healing process going after it has already been bogged down. And so in theory, it sounded great. It sounded fantastic. It sounded like, okay, well, we've got this chronic inflammatory response. Nothing's happening. Nothing's going on. This ultrasound, we stick it on there, and it kind of gives it a nice little kickstart and starts to facilitate healing. And as I was kind of alluding to at the beginning of this podcast is, a lot of people jumped on board this has been going on since the 80s and 90s. And as our research, our ability to research and our the resources to research in terms of the schools and monies that are being devoted to this, what we found is over the last 15 years is that it really doesn't work. We don't have to go way deep into it, but for the most part, it's not significant enough to be applying it unless it's kind of a last resort type of thing. So really that put a big poo-poo on the ultrasound world and that whole industry. Anything to add with that?
I feel like what I said was exactly what you said, but shorter and made way more sense.
Absolutely not.
No,
absolutely not.
I'm pretty sure that
you said a cavitation. You know what a cavitation is?
Movement.
No.
So if I pick my baby up and I shake my baby, that's cavitation, right?
No.
Okay.
Cavitation.
That's shaking baby syndrome?
That would be DCFS being called to your house. That would be you losing your children. Thank God you don't have any more infants. No. Cavitation is when there's nitric oxide released in the joint during like popping and clicking.
I'm just using fancy words.
That's cavitation. And then the nitric oxide is actually a natural muscle relaxer, which causes the muscles to relax, which is why we become addicted to clicking and popping our joints, because it only lasts about 20 minutes, and the cavitation reloads in about 20 minutes, so we pop and click our joints every chance we get to get that muscle relaxation. So yes, no. So you were close.
I was 50% of the way there.
I like your math. I love your math.
It's a guesstimation. Yeah. I'm rounding. It's a rounding error.
Yeah, big rounding error. All right, so
the long and the short of it is it purported to do things that it doesn't do. Yes,
and it's important not to hang your hat on that when you're trying to rehab.
Yeah,
I think that's the big takeaway. All these, like I said, the ultras, and actually going back to the iontophoresis that we originally talked about right at the very beginning, that actually most of that has been refuted in research also. So it's been disproven also that the iontophoresis, as Will kind of talked about it, two magnets kind of pushing the drug deeper into the skin, that's not very, it hasn't been deemed effective or clinically significant either. So the only of the big three, I would say that e-stem still has some good application when used properly, and can be implemented into treatment regimens. It's not something that you do a lot in the clinic, but it would be more like the TENS unit at home, application where you can apply that.
Yeah.
And then ultrasound,
Maybe.
Ionto, icy hot, kind of same as TENS unit, used with discretion. Other than that, what else? I feel like we've gone long on this one.
Yeah, no, we're still about average.
Okay. Well, that's
about us.
We're average.
We're always average.
Don't do any better or worse, just average. All right. Anything else?
Nope. That's all I got. Those are the big three that I thought we should talk about. I mean, because there are like other ones that we don't need to touch on any of those right now.
Yeah, and I do actually want to give a shout out to my 7-year-old daughter, who will never listen to this, but I am very proud of her because I shut the doors of my office today, and she's home with me today. And usually she's pounding on the door in the middle of any kind of phone conversation business phone conversation that I have, and she has not done that. So I have no idea how this happened, but somehow hopefully the rest of the house isn't on fire.
Well, good luck with that.
Yeah, thanks.
On that note, we'll wrap this baby up. This podcast was for educational purposes only. It was not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment. Remember, treat yourself.
Peace.